everyone, this is Dr. Prakrati Acharya. I am a nephrologist and an assistant professor of medicine with Texas Tech University Health Sciences Center, El Paso. Thank you very much for attending this session, and special thanks to Lone Star Chapter Lupus Foundation of America for extending this invitation to me. Today we are gonna talk about lupus nephritis, or how lupus affects the kidneys. But before we get started, I wanted to let you know that this is an educational session, and in case of any changes in your treatment course, any changes in your medications, please consult your primary nephrologist or rheumatologist. So let's get started. As you all know, lupus is an autoimmune disease. What that means is your body's immune system does start acting against your body itself in lupus. When your body's immune system does start acting against the kidney in lupus, that's what lupus nephritis is. Lupus nephritis does affect both males and females, and as does lupus. But there is a higher propensity of the disease in females, and that too at a younger age even. It does affect all ethnicities, but the disease does have worse outcomes in Hispanics and Black patients compared to Caucasians. When lupus does affect the kidney, it usually happens within the first 6 to 36 months of diagnosis of lupus, but again it can happen anytime. Lupus, when does affect the males, it does have a higher propensity of affecting the kidney or the cardiovascular system. As I said, lupus can be asymptomatic lupus nephritis when it's presenting as lupus nephritis. And thus, it's very important to have regular screening tests, which include screenings for your blood and urine, to diagnose this disease early. Thus, their screening for blood and urine tests should be done at the time of diagnosis of lupus, at the time of any flare, or at least yearly by your rheumatologist or primary care or nephrologist. The goal is to diagnose the disease early so it can be treated early and prevent towards progression of kidney disease. The disease can be asymptomatic in a vast majority, but again, there are several patients who can present with symptoms at the time of kidney involvement. These symptoms could be swelling, which could be due to putting extra water weight. Some patients can actually lose weight, have a decreased appetite, feel extremely tired, or start developing high blood pressure or hypertension. How we usually diagnose is by looking at the urine. If there is any increased protein in the urine, or if there are red cells in the urine, and a special type of casts in the urine called red blood cell casts that increases our suspicion of lupus nephritis. But the sure shot way of diagnosing lupus nephritis is by doing what is called a kidney biopsy. What kidney biopsy means is that a needle is put inside the kidney to take a small piece of tissue, and then we look at it under the microscope. It's usually done under ultrasound guidance or CT guidance, either by your nephrologist or by an interventional radiologist. It's mostly an outpatient procedure unless there is any complication, at which time the patient might need to be admitted. The major complication could be bleeding or infection. But again, before doing this procedure, the nephrologist and the radiologist would explain it explicitly. So usually the kidney biopsy is done when there is more than 500 milligrams of protein per day in the urine, or if there is increase in the toxin level, which is measured in blood, called creatinine. When we do a kidney biopsy, we do see different patterns. And based on these patterns, there are different classes of lupus nephritis. Based on what class we see for an individual patient, there is a different treatment decision. As I mentioned, it's very important to diagnose the disease early so that we could avoid flares, could treat the disease early, and tell the patient to be compliant with their medications so that it does not progress towards renal failure. The treatment of lupus nephritis mainly includes medications called immunosuppressants. What these medications do is decrease your immunity, so the body's immune system doesn't attack the body that much. There are different medications under this immunosuppressant class. Prednisone is a major drug which is used in lupus nephritis. And it can even be put out as the drug that puts water on the fire. So it's a very important drug in the treatment. Other drugs that might be needed are like antihypertensives, like blood pressure medications. There are some specific classes of blood pressure medications called ACE inhibitors or angiotensin receptor blockers, which are given preference because they decrease the protein in the urine as well. Again, the treatment decision is individualized. Antimalarials like hydroxychloroquine are also used for the treatment. For the treatment of lupus nephritis, there are usually two phases. First is the induction phase, in which an initial high dose of immunosuppressant is given for about 3 to 6 months, based on how the disease responds. Followed by that is a maintenance phase, during which these immunosuppressant doses are decreased and the disease is monitored very, very closely to avoid any flares. Because at the time of flare, the immunosuppressant might have to be increased again. So as I mentioned, steroids are a main drug. Hydroxychloroquine is another drug which is used for lupus nephritis and lupus in general. During taking hydroxychloroquine, it's very, very important to get regular eye exams to make sure that it's not causing any eye complications. The other main classes in immunosuppressant drugs would include cyclophosphamide, mycophenolate. Those are usually the first class of drugs that we choose from. Again, cyclophosphamide can be IV, can be oral. The decision on which drug to choose is individualized based on how the kidney biopsy looked, what's the patient's disease progression, how progressed the disease already is, what's the age of the patient, what's the past medical history, and what complications can happen. And again, a very important part would be an informed decision with the patient after discussing the side effects of both the drugs. So cyclophosphamide can be given IV, mycophenolate is mostly orally, or it's given as a oral medication, which the patient can take itself at home. Based on how the disease responds in 3 to 6 months, we do taper down and reach the maintenance phase. Sometimes the disease does not respond as well as we would have expected. In that case, the treatment line needs to be changed at times, and there are other drugs that can be used, such as rituximab or a multi-targeted therapy, including mycophenolate and another class of drug called cyclosporine. There are newer medications which are also being looked at for lupus nephritis and lupus, such as voclosporin and belimumab. Again, based on how someone responded, the medications are tapered down over time. We are in a crucial period of time right now with the COVID pandemic going on. Anyone who is on immunosuppressants does have a higher risk of acquiring any infection, as goes true with COVID too. It's very important that when someone is on immunosuppressants, they should follow all the rules and regulations or CDC guidance. Basically, wear masks, avoid crowded places, wash your hands frequently, use sanitizers, and very important is getting the COVID vaccine, because actually that's the almost only thing we have right now to avoid or prevent the spread. And as you all know, if someone is on immunosuppressant, actually the third booster dose of COVID vaccine is also approved and given. So please keep that in mind. That's very important, especially in this time. Avoid crowded places. As with COVID, again, any person on immunosuppressant is at a high risk of infection. So very important to take your flu vaccine, pneumococcal vaccine, and when we put someone on immunosuppressant, especially at high doses, the physician usually would prescribe some antibiotics depending on which or antifungals depending on which region they are, to prevent certain bacterial and fungal infections. So again, very important to take those medications as well. Medications are also prescribed, such as pantoprazole, an acid suppressant medicine, or calcium and vitamin D, when someone is on high dose of steroids. So very important to take these medications along to avoid complications. As I had mentioned earlier, lupus is mostly a disease of young females, a age of childbearing too. Thus, it's very important to discuss about pregnancy in lupus. Lupus can have more complications both for the baby and for the mom if it hasn't been planned, and what's recommended is that the disease should be quiescent or quiet for at least 6 months before the decision to get pregnant. Very important to discuss this with your nephrologist or rheumatologist before a decision to be pregnant is made. The reason being, certain medications which are used during the treatment of lupus nephritis can be teratogenic. That means that they can affect the baby. So once the disease is quiescent and your physician tells you it's safe to be pregnant, they would usually change the medications to something that would not affect the baby or would have a lower teratogenic potential. Like, we would not want someone to be on mycophenolate or cyclophosphamide at the time of being pregnant. So would be changed to other less harmful or teratogenic medications like azathioprine. Prednisone can still be used if needed. Certain antihypertensives are also changed, like ACE inhibitor or angiotensin receptor blocker, again to avoid complications in the baby. Thus, it should be a decision that should be made along with your physician, and please follow the guidance there. During the pregnancy time, there is a chance or risk of having a lupus flare, and there are other classes of medications that are used to treat. As I mentioned, the name azathioprine can be used, prednisone can be used, hydroxychloroquine can be used, cyclosporin can be used. So these are certain medications that can be chosen from. And again, it's very important for the disease to be quiescent or quiet. There is an increased complication risk compared to general population in lupus nephritis or lupus patients with pregnancy, which can involve preterm delivery, premature birth, preeclampsia, and thus usually a high-risk OBGYN physician is involved. As I mentioned, it's very important to take care and be compliant with the medication, take them regularly. The goal is that the lupus nephritis doesn't become that worse that could lead to dialysis or kidney failure or end stage renal disease. Even though things are done right, sometimes patients do end up on dialysis, unfortunately, and about 2% of the dialysis patients are on dialysis because of lupus nephritis. Again, when the kidney function is declining, your physician would inform you way ahead that that's happening and treatment course might need to be changed. Something that should be kept in mind is dialysis is thought or should be considered as a bridge therapy, ultimately to get a transplant if other health conditions allow. What's more or has better outcomes is a preemptive transplant. By that I mean getting a transplant before even getting on dialysis. For that, it's very important to even talk to your friends or family members about kidney donation if it reaches that point. So, sometimes some patients do have to be on dialysis, but the goal is later to put them on the kidney transplant list. As you know, there is a scarcity of organs, and sometimes the waiting period can extend up to years. But living donors' kidneys do have a much better outcome compared to cadaveric kidneys. So again, lupus nephritis is a prevalent disease, and I'm glad you guys could have time and I had the opportunity to talk to you all. Thank you very much.